More and more Americans are trying to find insurance coverage on the newly revamped healthcare.gov or other health exchange websites. But there are still complaints about the enrollment process. Congressional delegates from Oklahoma are among the millions of people struggling to get coverage under the new law. Here with more is Chris Castile, joining us from the Oklahoman's office in Washington, D.C. Chris, thanks for your time today.
Absolutely, Dave.
I trust it's as cold there as it is here.
It is quite cold here. I mean, I'm hoping this is kind of the snow that we're going to get this year, not just the beginning of it.
I agree. I hope we've peaked, and from here on out, it's sunny days. Well, let's get into this topic. What challenges did the Oklahoma lawmakers find in buying coverage through the exchange, and why were they buying in the first place?
Well, that's a good question, David. In the Affordable Care Act, the Affordable Care Act did not apply to most of the federal employees. The hundreds of thousands of federal employees out there will continue to get their coverage the way they have before, through a menu of plans that they're able to select, and that's civil service workers at Tinker to Social Security workers, the whole bit. But there was a Republican senator from Iowa when the bill was under consideration who put a provision in the Affordable Care Act saying members of Congress and their staff members have to go out and buy their insurance through these exchanges once they're set up. So the exchanges are set up, members of Congress and their staffs are now having to go and get their insurance through the exchange set up here in Washington, D.C. by the city government. So they've encountered all the same kinds of challenges and more that we've been reading about since these exchanges opened on October 1st. Just spokesman for Congressman Frank Lucas, Republican from Cheyenne, told me he spent at least 5 hours over 3 weeks trying to enroll and never did really feel like he'd been enrolled, confirmed, never got any kind of confirmation, so he's always anxious about it. Representative James Langford, the Republican from Oklahoma City, has gone through the same thing, tried multiple times to get enrolled through this exchange for him, his wife, and kids. Finally gave up today, the deadline for enrolling and sent in a paper application. So, and some of the mistakes or some of the problems that these people encountered, there was a staff member for the Tulsa Congressman, Jim Bridenstine, whose name is O'Hara. And when he was trying to finish the enrollment and it asked him for his electronic signature, it wouldn't accept the apostrophe in O'Hara.
Oh, wow.
And so he tried to do it without the apostrophe, and then his name didn't match, the name that he enrolled at.
Fields suddenly weren't matching.
Exactly. So, I mean, it's just, I think late last week, Congressman Tom Cole, who's the chairman of the spending committee over the legislative branch, had gotten a report. Here's how many House members and staff members who have been able to sign up for health insurance who want it through the exchange. It was about a third of each, about a third of the House members and about a third of the staff members. This is just days before the deadline. Only about a third had been able to get through.
Chatting via Skype with Chris Castile in Washington, D.C. And Chris, I think I read that the costs are higher, but do these lawmakers have to pay all of those costs?
They do not. They even though the law, the Affordable Care Act, required them to go out onto the exchanges to purchase their health insurance. It was kind of a rule-making process that took place here with the agency that oversees employees that still allowed them to collect the federal subsidy for their insurance. I mean, like most people who get insurance through their employees, your employer subsidizes that. He or she, the employer, the company, pays for a big chunk of that insurance premium. And that was the case for them when they were, under the federal employee benefits program. And that will be the case still as they enroll through the exchange. The federal government, their employer, will still cover about 75% of the cost. And that will mean more taxpayer money going to health insurance, because the cost, almost every Oklahoma lawmaker I've talked to has had increased costs and premiums and deductibles, which is their out-of-pocket costs, and some pretty high. Senator Jim Inhofe said his premiums went up 20%. Representative Tom Cole said his went up almost 30%. So because they're not paying that entire amount, that obviously the share that the federal government picks up will be more, but also these people will be paying more out-of-pocket as well.
Interesting. I'm sure it's been an enlightening experience for everyone involved.
Well, these are guys that are obviously opposed to Obamacare in the first place. They were against it, and they predicted this kind of thing, and now they get to experience it firsthand.
And probably a little bit of I told you so, right?
Probably.
Chris, thanks for your time today. Stay warm out there, sir.
You too, Dave. Thanks.
All right, more coverage from Chris Castile can be found in the Oklahoman and online at newsok.com.